of the face, and there's ongoing recession in this area. There's other points that we need to understand when we're looking at the vertex. Besides saving enough grafts to work in the areas that count, we also have to think about why potentially we won't get as much density in the vertex compared to the other areas. One of the reasons, if you think about it, it's like a billboard effect. When you look at the vertex, it's a vertical plane of the scalp. You're looking back there and you can actually see your grafts. That is very important because you can see the scalp compared to when you're looking at the top of the head, the horizontal portion. When the hairs are transplanted, you can't see the scalp because you're looking at it from head on. So that billboard effect is very important in terms of understanding why we may not be able to achieve the density levels that you may be desiring, but in general you can see our results are very, very good with reasonable expectations of what we can do to transplant, plus with the addition of medical management that can help out as well. The second reason is the fact that we have to use very, very tiny grafts. In the areas up here, we can use slightly larger grafts to create visual density, but that's unforgiving when we're looking directly on this like the billboard. So it's very, very important that we have to use tinier grafts, so that means we may have less density. The final reason, or another reason, is the fact that all these grafts, instead of being aligned like this in interlock forward when we're doing the frontal and mid-scalp region, are going to be in this whorl pattern, so it's going to be opened up. And so that's very, very important as well. And the final, as we mentioned, we have to have enough hair to really do enough what we want to do. So transplanting the crown or vertex may be less than satisfactory in one session, and it may require a second session. And we always have to think about graft conservation when we're looking for total hair completion. The other thing that's important too is that in this crown region, when someone is having, when they wet their hair, there's a greater see-through effect in the lower area. And whenever we work on the crown, I spray the area down a little bit to clean it and to wipe off any little bit of blood that may be there. And that usually reveals a wider area that needs to be transplanted. So that's another reason why I have to use further grafts going further out to make sure that I have enough to work against that further recession. So in other words, I'm transplanting into the thinned out hair that you may not see when the hair is dry, but becomes more visible when we get into the wet zone, when we wet the hair, that is. And also I'm planning against future loss in this area. A good reason to transplant the crown, besides getting good coverage across the whole area, is that besides the back view of when someone's looking at you, the side view can be improved as well. And we oftentimes show that in our before and afters, and also when we're discussing with a patient, because when you don't have hair back here, there's no lift, and all of a sudden there's this drop off. When we create good lift, and that's the other thing, is great angulation of grafts is so important. There's a little bit higher arc of the grafts back here compared to up here where the grafts are slightly lower. To create that lift, so when people look at the side view, it doesn't go all of a sudden flat. So that's another technical pearl in terms of understanding why we create better visual density, but also a better density even when you're looking from the side view and seeing that lift pattern in that area. So those are very, very important concepts when we're looking at the vertex in terms of restoration and setting up realistic expectations of what we can do in this area. When we look at transplanting the vertex, a couple small points. We just talked briefly about all the different whorl patterns that exist out there. Realistically, I'm almost never going to create a double whorl pattern because it's very complicated to try to create all these interlocking grafts. In addition to that, it's already very complicated. But the idea is that we want to create maximal coverage in this region so that if we have multiple patterns that are going like this, you're not going to get as much coverage as arcing over. So how do I create density in the crown? There's really three ways to create density. One is going to be what's called just basically uniform placement of grafts, and the second one is going to be what's called concentric thinning, which means someone putting more density on the outer rim of the vertex. To me, this really makes no sense. For two reasons. One is the fact that that's the least impact that you're going to get on this area, and plus, if someone loses more hair around it, then you're getting a double halo effect, which is a very unattractive and unaesthetic and also, more importantly, unnatural look. So I do some shading with density, but I use a generally consistent density throughout this area. And what I do is over the upper portion as it comes forward, I use a little bit higher density to create more visual impact as it goes up and over than the hairs lower down. So there's that cascade effect where the hairs coming over and down is going to create better coverage of the crown, plus that is going to create less see-through as it comes up, as you're looking back over as the hair comes forward, in other words from the frontal view, and as I said, the lift from the side view, that upper arcing arch of the hair is also going to be improved as well in terms of all three views. So that's why that upper arc is going to be more important. That's not very much talked about in the literature. Most people talk about either uniform placement or concentric thinning, both of which in my opinion don't make much sense. I use a higher density over the upper arc of the crown, and then a little bit more gradually less density so that I can maximize graft distribution. Hopefully this short video is helpful in terms of your thinking about realistic expectations, what we can do in the Vertex, and also save candidates, and also just considering some of the ideas of hair growth and hair loss in the Vertex or crown region.